It's not going to be as simple as going and buying cereal, and that's because there's going to be a little bit of TurboTax involved in this. Because no longer are you going to be filling out a long health survey, but you are going to be asked questions about your income. And the questions are going to be about how much you think you're going to make the next year, and they ask you that because they want to see if you're going to qualify for premium subsidies, which I'll get into pretty quickly next. The new insurance is also going to have these 10 essential health benefits in it. Any new insurance that's sold in the private market or in the marketplace after January 1st, it's going to have these things in it. And it's interesting, if you go and look at health insurance websites right now, most of the plans you can buy that take effect on December 1st don't have maternity care. They don't have certain benefits, that prescription drug care, or maybe they'll cover the first $200 of an ambulance ride and then you're on the hook for the rest. There's a lot of fine print that it's important to read when you buy insurance today in the private market. Going forward after January 1st, it's going to have these 10 essential health benefits. It's going to cover maternity care. It's going to cover things that you really want it to cover. And there will be some options for people who just want catastrophic care, but for people who want, robust insurance, it's all going to be there, including adult vision and dental, which can be purchased as a rider. And when you go on the marketplace, this is what you're going to see. Well, not exactly. It's actually going to have plan names. But you're going to see insurance plans divided by different color codes, by different metal tiers, sort of getting us ready for the Olympics coming up in February. There's going to be bronze, silver, gold, and platinum insurance plans. Now, all those plans are going to have the same benefits. Not like the bronze plan's not going to have maternity care and the gold plan is going to have maternity care. No, they've all got those 10 essential health benefits for the most part. There could be some slight variations within them. But how they differ is in how you pay for the insurance. A bronze plan, as you can see, is going to have low premiums but higher cost sharing. That means your deductible, your co-pays are going to be much higher, maybe $20 for prescription drug, $50 to see a specialist. A gold plan, on the other hand, is going to have higher premiums but lower cost sharing. So you're going to pay more month to month, but when you go see a specialist, it's going to be $10. When you get a prescription drug filled, it's going to be $3. So there's different ways that you pay for your insurance. And what it does is it gives you more of a selection. So that if you use a lot of health care, then a gold or a platinum plan probably makes more sense because you're going to save more money overall, even though you're paying higher premiums. If you don't use a lot of health care, if you're young and healthy, then a bronze plan makes a lot of sense because you got low premiums, and if you need an occasional doctor's visit, yeah, you're going to pay more, but you're going to save more overall because you're not paying as often. Catastrophic plans, which I'll mention in a little bit, are kind of outside of that, and they're primarily designed for people under age 30, and as well as for low-income people as well. So they're a little bit different. They don't have all those 10 essential health benefits. In fact, if we jump to the next slide, I think I've got the description. I call it the Utah Snowboarder Plan, which is actually, you guys got some snow going on, it looks like today. So it's something to keep in mind. If you are going 25 miles an hour and you hit a tree, you're probably going to get a $20,000 hospital bill, depending on how many casts and tubes they put into you. The catastrophic coverage is going to be really inexpensive for young people under age 30, but it's going to cap what you pay for any kind of hospital bill at $6,300. So if you wind up with a $20,000 or $30,000 hospital bill, it's like buying a nice Lexus. All you're going to have to do is buy an old Subaru when you pay your bill, because you're going to be paying up to $6,300, and then the insurance is going to cover the rest. So it's a really good option for people who are like, insurance isn't for me, but then go and like to jump off cliffs, ride motorcycles, or snowboard, down mountains, because it's a good, inexpensive, but financially secure insurance product that's out there for people under age 30. So I just bring that up when I'm within these kind of younger audiences, because it's certainly something not a lot of people know is going to be an option. You don't get premium subsidies if you buy it, but the premiums are actually pretty low, $60 a month and things like that. So it definitely can be worked into a lot of budgets. Jump to the next, thanks. If we were to look in Salt Lake County, this is actually what this is Weber County. I put the Weber ones in. These are the cheapest plans by age in Weber County. If you go into the insurance marketplace right now and you were to look by age about what is the cheapest plan that you could buy, these are different providers are providing these different plans. This is what they would cost. So if you're a 30-year-old in Weber County and you want to buy a silver plan, the cheapest plan is about $193 a month for a 30-year-old in Weber County. For a bronze plan for a 30-year-old, looks like it's about $150 or so. You can see this line right here. Now there are insurance plans can't charge you more based on your health history anymore if you buy this new insurance, but there are three things that they can charge you a different price for. If you notice here, this is Weber County. If we were to buy insurance in Salt Lake County, if you were a Salt Lake County resident, it would actually be a different price, because there's 6 regions across the state that insurance companies have varied the prices by. Salt Lake County is actually the cheapest. Weber County is the second cheapest, then Utah County, and then sort of there's other regions around the state. Now, why can they do that? Because insurance companies have decided that delivering health care in different parts of the state costs a different amount of money. So they're able to adjust the prices based on the different costs that they incur. Another way they can charge you more is whether or not you use tobacco. If you use tobacco at any point in the last 12 months, you have to answer that you did use tobacco, and they can charge you up to 50% more for a portion of the premium for that. And the third is actually very evident. It's age. The older you are, the more you're paying for a plan. Although it's a little bit different. It used to be that insurers could charge you 6 times more based on your age than an older person versus a younger person. After January 1st, that drops down to 3 to 1. So the age band is going to be shrunk, which is one reason why my nanny, who's 60, is going to be paying less when she goes and buys insurance that starts after January 1st. So there's 90 plans in Weber County offered by those 5 health insurers you see right there, and they range from the catastrophic to the gold. I don't think there's any platinum plans being offered. So these are the cheapest prices. If we jump to the next slide, we'll actually see the most expensive prices. So that 30-year-old buying a bronze plan, the most expensive bronze plan is about $220 or $230 a month. I think it was $150 was the cheapest, $230 is the most expensive. All the other ones are going to be somewhere in between those. So this is a little bit of a bookend of what plans are going to cost. But as I mentioned, this is a sticker price. You're not going to pay more than this, but many people are actually going to end up paying less, and here's how. We expect almost 300,000 Utahns to qualify for premium subsidies if they shop for insurance through the marketplace. It's actually about 10% of the population here in the state. It's actually quite a few folks up in Weber and Cache counties as well. It tends to be where younger people are, and younger people tend to have lower incomes, and they're the ones who end up qualifying for these subsidies because, you can jump to the next. How much you make determines whether or not you're going to get a subsidy and how big that subsidy is. If you're on this chart, you can see yourself on this chart, or your family on this chart, then you qualify for a subsidy. Because for people who make between 100% and 400% of the federal poverty level, which for a single person is between about $11,500 and $46,000 a year. Now the subsidies are sliding scale. So someone who's right here is going to get a bigger subsidy than someone who's over here, based on your income. And so you could be up to a family of 4 making $94,000 a year and still get a little bit of help every month to pay for your insurance premium. And the median family income in Utah is about $57,000, right about here. So there's a lot of folks who are going to qualify for these subsidies. Now, if you work for Wells Fargo and get insurance from Wells Fargo, can you qualify for a subsidy on the marketplace? You can't. Because if you have employer-based insurance, the idea is that you stay with that employer-based insurance. It's only really for folks who are uninsured, self-insured, buying their insurance in the private market, or have just never been able to get insurance because of their pre-existing conditions or how much it costs. So these are the folks who can actually take advantage of the subsidies. Now you work for Wells Fargo and you lose your job. Then you can go to the marketplace and buy insurance. You don't need to have a job to be able to go and access this kind of insurance. Let's take a look at some examples. Here's looks like someone from Ogden down in Moab. Henry earns $18,000 a year. There's a new chart that says if you earn $18,000 a year and you're a single person, you're expected to pay about 4.31% of your income for your insurance, which for Henry would be about $775. Now he buys a silver plan that costs $2,300 a year. So what that means is that his premium is going to be $193 here in Weber County. He's going to pay $65 a month, and he's going to get a subsidy of $128 a month, which means every month Henry's going to write a check for $65 to his private insurance company. Every month the federal government, the Treasury Department, is going to write a check for $128. The 2 checks are going to meet at the private insurance company and make up the full premium. That's how it's going to work. All of a sudden, Henry, who probably could think of a lot of other things to spend $193 every month on, is going to be insured for $65 a month, which is probably cheaper than his cell phone bill, to be honest. So it probably makes his mom pretty happy too. But that's just one example. Let's look at another. The Shumways, they live up here in Ogden. These are fake people, by the way, not real. They're buying insurance for 3 because they got a kid on the way. They make $44,000 a year. The premium would normally cost them $460 a month, but they're going to pay $263, if I'm doing this right, yeah, and they're going to get a subsidy of $193. So instead of paying, almost $460 or almost $500 a month, they're going to be able to be insured, have the delivery covered, prenatal care, all that stuff covered for $250, $260 a month. So all of a sudden insurance is a little bit more within reach of this family who obviously, whatever job they have or jobs they have, they're not getting it through their employer. And then lastly, one more group. This is a family we encounter quite a bit, the people waiting for Medicare, folks like my nanny. So they make $42,000 a year. Their premiums would be a lot more. Look, $10,000 a year, almost $900 a month. One reason why is they're much older. Insurance companies can charge them more because they're older. They can't charge them more because of their health history anymore, but they can still charge them more because of their age. But they're just going to pay $300 a month, and they're going to get a premium of almost $600 a month to make that insurance more affordable. Now, why is that important? Well, I know firsthand from my nanny is that she's going to qualify for Medicaid in 5 years. She's right at this age right here. But if she's uninsured for the couple of years before she gets on Medicare, I'm sorry, not Medicaid, Medicare for the older folks, she's going to be in a lot worse shape when she shows up on Medicare when she turns 65. If she's insured leading up to those years that she gets on Medicare, she's going to be healthier and she's not going to incur those huge costs on our public healthcare system through Medicare. So that's why insuring these folks makes a lot of sense, because all of a sudden they're going to be getting their diabetes taken care of, they're going to be getting their high blood pressure taken care of, get those medicines, get that preventative care, so they're going to be healthier when they go on Medicare. And Medicare is actually the biggest cost driver of healthcare in the United States. So it's huge if you look at its influence on our budget. So getting them healthy is really important for the rest of our economy as well. So those are 3 examples. If you would actually like to run your own examples on yourself, you can do it on this website, kff.org, Kaiser Family Foundation. They have this website where you actually put in your zip code. It knows it down to the zip code in terms of what you'd be paying for health insurance and then what you'd be getting as a subsidy. Now, it doesn't tell you all the plans. There's a website called Health Sherpa that does that. But this one at least will tell you what, if you bought the middle-of-the-road silver policy, kind of the bullseye policy, what you'd be paying and what your subsidy would be, and that's what I used to create those examples we just saw. So kff.org, the premium subsidy calculator on that website. And it works. It's one of the websites that actually works. So now, where is all that money coming from? You saw that family, the 60 and 62-year-old, they're getting $600, $700 a month in a premium subsidy. Where's that money coming from? I often joke that we're growing it out in western Utah using rainbows and unicorns, but you guys are too smart. You're not going to believe me if I say that. So this is where it comes from. It comes from cuts, and it comes from taxes. These are the cuts. There's cuts in Medicare Advantage plans, which are private Medicare plans. They pay up to 17% more than traditional Medicare. The government said we don't want to pay that extra 17%, so they're ratcheting it down over the next couple of years to be on par with traditional Medicare. About 30 to 40% of Americans have these private Medicare plans that they're using. So that will affect not their benefits, but it will affect how much their doctors and hospitals are getting reimbursed for the care they're providing. So something that influences people on the provider side of things. Uncompensated care for hospitals is being cut. Hospitals treat a lot of people who are uninsured. Those people can't pay their bills. The hospitals write off their debt. The hospitals are reimbursed by the federal government through what's known as DSH payments, or disproportionate share hospital payments. Well, if more people are getting insured, the federal government's like, well, why do we have to pay these hospitals all this money if more people are actually going to be able to pay their bills from now on? So the hospitals are going to lose about $56 billion over the next 10 years that normally went to pay for this uncompensated care. Kind of a leveling out. The idea of more people have insurance, hospitals don't have to provide as much charity care, so the federal government can stop subsidizing that through the DSH payments. Medicare and Medicaid payment rates. Many of these have actually been pre-negotiated between doctors and hospitals about what they pay for a colonoscopy or what they pay for specific procedures. And that's actually a huge amount of cuts. Remember I said Medicare is one of the biggest cost drivers in our economy? If you make something cost $5 cheaper in Medicare, you save, millions of dollars within a couple of weeks because of the sheer volume and the sheer impact that it has. So a lot of the cuts are happening in reimbursement rates for hospitals and doctors through Medicare and Medicaid. A lot of them have already been pre-negotiated and the doctors and hospitals agreed, but that is, of course, almost half of the, more than half of the cuts that are happening over the next 10 years. So again, a big hit on the provider side. Not that patients are going to experience it, but it does hit the provider and hospital side. And then there's taxes. The way I like to say it is we all hope we get hit with the Obamacare taxes. A lot of people shake their heads and they're like, what? It's because the taxes that personally affect individuals are for people who make more than $200,000 as an individual or $250,000 as a couple. And those are taxes on your capital gains. So you sell a stock, you sell a bond, you make money on that, and you earn over those income limits, you're going to get an extra 3.8% tax on that. So definitely folks who are in the higher income ranges, I think it's about 3% of Utah families fall into that category. Also, if you sell a house and make more than $500,000 profit, there's going to be an extra 3.8% tax on any dollar amount over your $500K profit. Medical devices tax, really big here in Utah. We have a lot of medical device makers in the state, especially down in Utah County. So they're getting a big tax on their net. And so there's a lot of companies that are upset about that. One thing I would say is if you read Elizabeth Rosenthal's New York Times story about a guy who flew to Belgium to get a knee replacement, his knee replacement would have cost, I think, $100,000 in Colorado, and it cost him $13,000 in Belgium. Even though the knee that he got, the titanium knee, came off the same loading dock, the same company in Warsaw, Indiana. So for some reason, the knee in Colorado cost $26,000 to actually purchase and pull out of the wrapper, and it cost $3,000 to do that in Belgium. So medical device makers have certainly been making a lot of money off their devices, and that's one reason why I think that they were targeted with this very specific tax on them. The penalties for individuals and employers are also a point of this. I guess you could call that a tax on individuals as well, especially the one for people who decide not to have insurance. Cadillac health plans, those are plans that have very generous benefits, no co-pays, no deductibles, often found in unions, auto workers unions, longshoremen, people like that, and executives have those as well. What that does is it causes people to use more health care than they need, which tends to cause more waste from the system. People have co-pays and deductibles because it makes you think hard about whether or not you actually need to go see the doctor. And imagine if you didn't have that, you would probably go a lot more if you didn't have to put some skin in the game. And then cost savings as well, the idea of the preventative care, getting more people into coverage. If you catch something earlier, usually costs a lot less money to treat it than if you wait till it gets really bad. So that's where the $200 billion of cost savings come from. These are the penalties. I want to jump through these quickly. You might know some people who want to pay the penalty, who don't want to get this new insurance. My brother-in-law is among them. He lives in California. He and his family are not going to get insurance. They're going to pay the penalty. They actually don't use electricity or cars as well, so they're a little bit unusual in the way they approach things. But they decide that health insurance is not something that they want to be a part of. So they will pay $95 per adult or $47.50 per child, up to a max of $285, or 1% of their family income for 2014. And then those penalties ratchet up until after 2016. They're pegged to inflation. And when I talk to my brother-in-law, and it's funny because my wife's a doctor, and her brother is this guy who doesn't believe in insurance. They have some big discussions, and they have money saved up to pay for healthcare bills, but they don't have $100,000 saved up. If they get hit with a $100,000 hospital bill, they're going to walk away from it, despite their best intentions. They're not going to be able to pay that. They have 100,000 cucumbers in a barn. They don't have $100,000 to pay any kind of hospital bill. So what the penalty does is it gets them to have some skin in the game. So that they have to walk away from a bill. They're not leaving that bill for the rest of us who are paying insurance premiums to pay for them. So that's the way the penalties are worked. That's how they're designed to, they don't give you insurance, but they do support a system that will pay your bill if you can't pay it. So those are the penalties real quickly. And at this point, I wanted to pass this around. We do this Health Matters newsletter that comes out actually next week. We do it once a month. It covers healthcare topics focused on Utah. We do it every week during the legislative session and every month for the rest of the year. We have a lot of issues coming up as we're preparing for the legislative session. But we talk about the same issues that I'm bringing up here. We bring you the updates on enrollment numbers. We talk about legislation that affects providers and hospitals. We talk about Medicaid expansion. We interview people who are sort of the movers and shakers in the healthcare field around the state. I used to be a magazine editor, as Carla mentioned, and so we really try to make it something that isn't going to put you to sleep. We try to make it something that is going to be read by a wide variety of audiences, including a lot of providers and doctors. So if you wouldn't mind, if I could, we'll just throw it. There we go. Thanks. Pass it around. If you're interested, put your name and your email. We'll add you to the list, and you'll get your first one at 6 a.m. on Tuesday morning. I'm sure you'll be waking up early just to read it. But Health Matters is the newsletter that we put out at UHPP. Thanks. So a little bit of information about health professionals, people in this field. I wanted to deliver some information. We had to get through the boring stuff first. I apologize. But let's jump into it. So first of all, we're kind of lucky to live in Utah. Utah has the lowest cost health care in the country. This was a Wall Street Journal article that came out earlier this year. If you look at Utah, we're, if not at the top, we're near the top of all of the key drivers of healthcare efficiencies. Now that's good in some way. That's actually really good for insurance companies because that means they don't have to pay as much money. They can run a much more efficient operation. It's actually not as good for providers and hospitals because they don't get reimbursed as well as places like New Jersey or Massachusetts where the costs are all much higher. So, I mean, and then the other way you can think about it is it's actually good for providers because they're dealing with a much healthier population. The obesity rates, diabetes rates, smoking rates, things like that in Utah are much lower than in other states. And so as a provider or someone working in the healthcare field, you're not dealing with as many issues as you could be if you lived in, Florida or New Jersey or something like that. So Utah is a special state. Whenever we go to conferences, they always put up charts, and Utah is always floating off in the corner, not with all the other states, because we have a lot of interesting dynamics at play within not only our economic side, but in sort of our demographic side as well. So you live in a special state. I guess that's what I want to get across. And if you decide to work or practice healthcare in Utah, there's some good and bad things that come across with that. Now, do we have enough providers in Utah? And that's one of the big questions that we've got. Now, if we look at it nationally, we do have a shortage in primary care physicians. This was a Health Affairs article that came out just this month that I have referenced there at the bottom. We have a shortage in primary care physicians nationally, and we certainly have that here in Utah. Primary care, as you know, are family doctors, internal medicine, pediatrician, and emergency room as well. So those kind of physicians we definitely have a shortage in. But the good news is we have a surplus nationally of nurse practitioners and physician's assistants. And so what I think we're going to see going forward is that there's going to be a new leveling of the provider networks. Despite the strong opposition from the American Medical Association and other doctors groups, mid-levels, PAs and nurse practitioners are going to get more involved in delivering patient care. And I think that's because of these dynamics that we're seeing here and because of all the new people coming into health insurance. They're going to be going and wanting a primary care physician to be able to treat their symptoms and make them better. So there's going to be some kicking and fighting, especially by doctors who don't want to give up some of the power that they have. And my wife's a doctor, so I see how that works. But we're going to see a definite broader field of people providing health care in our country, and specifically on the mid-level side of things. So that's how it looks nationally if you look at by year 2025. I think the next slide, actually, could you skip forward one more? This is how it looks in Utah. Utah does have a shortage of primary care physicians like many other states do. And part of it is that we have a very fast-growing population, and we only produce, I think it's 60 to 100 new doctors a year from some of the different facilities we have here. So, we certainly are low in terms of these numbers, but this is the other thing. What we really have a shortage of in Utah is pediatricians, because we have the youngest population in the state. We actually are pretty good on internal med and pretty good, especially on geriatricians and people like that. What we need are more pediatricians because we have a lot of kids. We need more dentists. Actually, we have quite a few dentists, I should say. More pediatric dentists. We definitely have a population bulge at the lower age ranges, and so that's where our primary care doctor and provider network is facing the biggest stress. So these are sort of broad numbers from the Kaiser Family Foundation. If you actually go to people in Utah, they say, yeah, we need more peds docs. We need more people focused on kids. If you could jump back one, thanks. And this is one reason why we don't have enough primary care doctors, is that very few people go into the primary care fields. Specialty has a really strong draw because of sometimes the work hours, but most often the salary. If you look at what a radiologist makes, $315,000 a year versus what the average starting